owner at that time, but before that, she had been a hospital administrator. So we went to his house. We got his medals from his military service. We got photographs of him before he was ill. It brought, all kinds of sort of evidence to show that he was respectable. And it worked. They looked at him, and we also told them that he is a scientist. If you explain things to him, he will not be distressed. He had colon cancer. He didn't understand what was going on. He was really upset. He calmed down, and I never forgot that moment. We got him out of that hospital, and he didn't live much longer than that. But that moment taught me that no matter who you are, why do we have to be respectable? Why did we have to play that respectability card just for my father to get, who was a veteran in a veterans hospital, to get the care and treatment that he deserved and to get the respect that he deserved? So when people ask me, what is your personal experience that informs your work? That's the one that touched my heart. So you can read it in the book too.
Since you started with that story, I'm so struck by the balance that we have to manage between telling this story of overt racism and then also absorbing that racism. And I'm reminded of a student you had who you talk about, a young black man who said, I don't experience racism, and you were like, I don't know if that's true. And he proceeded to tell you about how many times he'd been routinely stopped by police. And his response was, that's just my life. So if you could just talk a little bit about that balance of speaking out, telling the stories, but also how we prevent it from becoming absorbed so that that's all that we experience as just our lives.
I think I wrote in my book about weathering. So weathering is it used to be called a theory, but it's so well proven, it's hard to call it a theory anymore. Weathering is a term coined by Dr. Arlene Geronimus at the University of Michigan. And it refers to what happens to our bodies when we have to endure racism every day. And it's not just enduring it, it's coping against it. She calls it high effort coping. And it's what do you do when you're confronted, whether it's a microaggression, that is someone doesn't trust you or thinks you're not intelligent or follows you around in a store. Or it's more macro, which is the police, housing, and discrimination at your job. When that happens routinely to your body, each time it happens, you know the feeling. Your heart starts to race, your blood pressure goes up, your cortisol levels rise, your body heats up. That should not happen routinely. It's unhealthy. And it creates a kind of accelerated aging. So the term weathering refers to both that, the way a house might be weathered by a storm. So the roof gets knocked off, shingles get knocked off the roof, the paint gets chipped. All that stuff happens during a storm to a house. But the house can withstand a storm. It weathers the storm. And that speaks to community, to family, to the people around you, to nurturing places like the Schomburg. And we have that. So when I think about that, I think, who are the people who are your people when you enter the hospital system or when you enter the healthcare system at all?
Right, absolutely. I mean, I often say that we are why we're here still, right? Which brings me to the first chapter where, at the end of this first chapter, you're talking about a white friend and colleague, a white guy, a white man, who's like, this is interesting, who said to you, it's not just up to you all to figure it out, because you were very much of this mindset that it's for us, by us, we will take care of ourselves. And there's a real reason that you felt that way. It stands to reason. So why was that moment so enlightening to you?
For me, I was raised at Essence Magazine, and so at Essence, we're a group of Black editors and writers who were, our mission, Susan Taylor's mission, was to really help the other folks, other Black people in America, to uplift the race, if you will. And that's where I came from. So plus, it just felt like no one else cares, and so we have to take care of ourselves and each other. It's up to Black folks to, I had to explain it to Steve, FUBU, for us, by us, and, but when he said, wait, this isn't, we were talking about HIV/AIDS, we were talking about other poor health outcomes in America. He said, this isn't a FUBU situation, this is an American problem. I had never thought of it that way at all, because it just didn't seem like anyone cared. When I started putting that lens on it, it made me do a different kind of advocacy, or a different kind of advocacy writing, a different kind of advocacy reporting.
Did it surprise you?
I was so surprised. I was like, people care, and it's funny because—
Not just people, but white people.
White people care. And also, when I interview, I often have a main character in my stories, and I remember somebody asked, one of the characters asked me, oh, that Arlene Geronimus, she is amazing. She is a hard-charging sister. I go, she's not a sister. Dr. Geronimus is a white woman who has been looking into the issue of weathering on Black people since she was a freshman at Princeton, and she's in her 70s now. This is her area of expertise. People do care.
So then I think what's really important about it, you have in some ways laid out, an absolute map for us to move forward in terms of this issue. You've also laid out a lot of evidence for why we may not trust moving forward. How does trust, given, I'm sure every Black person has somebody in their family who's like, I'm not going to get a vaccination, right?
Right.
And I get it, So how do you talk about trust?
Well, I first start to talk about distrust, because a lot of people, when COVID happened and people were saying, I'm not getting vaccinated, and they were like, why? And I said, this is easy to explain. And I started, I used to start at 1850, but then start at 1619 and go back. What happened to us during the years of slavery? We were experimented on. We were treated badly. There were myths, medical myths and scientific myths created to keep us enslaved. Next round is, it didn't end with that. I pick up again with the Tuskegee experiment. Then I move on to the Relf sisters in 1973, who were sterilized without their consent at ages, and without their parents' consent, informed consent, at ages 12 and 14. Then there's a huge study that in 2002 that was the definitive piece of evidence that said, no, Black people, especially people of color, especially Black people, are simply not treated the same. And I think the sort of piece of evidence that really struck me the hardest was a really smart study that looked at two groups of people, Black people and white people. They had equal levels of diabetes, the equal severity of diabetes and levels of health insurance coverage. Yet the Black patients were more likely to get an amputation when all things were equal. And I'm thinking, I don't think physicians and nurses and other healthcare providers go into the practice to hurt people, but somebody is making a decision to cut off a Black person's foot more often. Something's wrong. But also, once COVID happened, and then you're sort of like, wait, we're getting COVID more often, people of color. Black people are being hospitalized more and dying more. And then there's just so much evidence, but there's also people's lived experience that's supporting it.
Right, well, so you just said, I'm going to talk about distrust first. No, I want to talk about trust.
Yeah.
I want to get back to that, because what you just said doesn't make me
distrust.
feel...
Okay, so trust is when you go into the healthcare system with your eyes open. And when you say, wait a minute, I read that under the skin book with all that evidence. I see that this is real. what do? You go in because you go in informed. You go in not like your doctor or the healthcare providers are gods, but like they are somebody who works for you. You go in with somebody else because you're probably afraid. You go in ready to, so you don't go in just like, well, I'm going to throw myself onto the system that may not care about me.
So the trust is in trusting yourself.
Trusting yourself and
your knowledge.
And the people who come with you. I go, my mom knows that no, I'm the bad cop when we have to go to the doctor or she's in the hospital or a clinic or whatever. I'm the one who people just ask me, who are you? Are you a doctor? I said, no, I'm a person that loves this person.
Yeah, and wants to make sure.
Make sure, and I want to understand everything.
It's a deeply complicated industry. I mean, we can talk about, racism that permeates every industry, but medicine especially and healthcare is already so fraught
and vulnerable. The vulnerability. You're not in your clothes. You're in a hospital gown. You may be hooked up to machines. You're relying on people and a system that may not always treat us equally.
And you also just said, I don't think that people or doctors go in to hurt other people, but somebody's making a decision to cut off somebody's foot. So where do you draw the line between individual accountability and systemic accountability?
I think, what I like to think of is this way. If everyone would just admit, and I don't just mean white folks, everyone would admit that it's easier to deal with or to connect with people that are like you. So if you look at the medical system and you look at who practices, especially at the highest levels, white people are most of the doctors. Men are still most of the doctors. So if you're a black woman, you may be, you're maybe dealing with someone who has trouble connecting with you. So it's up to, in my head, it used to be, and still I'm saying, take care of yourself, but it really is at this point up to the healthcare system and the healthcare establishment in America to say there are biases that are baked into our system, that are baked into our society and our culture, and baked into ourselves that I have to grapple with. Mm-hmm. And I'm a half glass full person, and I do see changes. I do see medical students trying to do things differently, and I'm excited by that. Many of them were politicized in high school and college during the Black Lives Matter movement and by what they saw. And when I go to, like visiting medical schools, I'm very surprised by the sort of fervent kind of activism that they have.
Yeah, I mean, I think that I agree that there are some changes and that we're always kind of evolving, maybe not as quickly as we would like to. But then I was listening to some of the interviews that you've done for the book, and I was reminded in listening to an interview you did with NPR, and I won't say with who, but how much white people like to listen to us talk about the racism that we've endured, particularly the overt racism that you've endured. And I just wondered, as I was listening, do you ever tire of that? And have you arrived at a place that you've weathered that?
Ooh, weathered.
Yes, I'm using that on purpose.
Sometimes I tire of it, and sometimes I actually think to myself, when someone is particularly stubborn and I'm having to really explain it, I'm having to dredge out all of the data, I do think, oh dear, I just lost an hour off my life because I just weathered getting so upset about some of this stuff. And I thought this morning, I said, ooh, my next project, I want to do something about Black joy. Yeah. I did wake up and think that this morning.
Yeah.
But actually, I just feel like I'm the person at this time. I've been doing this for so long. I've been gathering this data. I can reel it off. I can pull it together. And so let me take this moment and share it.
It's called Under the Skin, and of course it's a great title. I'm like, oh, that's a great title. But what's under and whose skin?
It was funny, my editor at Doubleday, who I really respect and really, really like, she said, one of the questions on the author questionnaire was, what does the title mean to you? So I said, under the skin is how discrimination, bias, racism really gets under the skin of Black people and affects our health. I've been working with her 3 years. She goes, oh, that's what the title's about? That's what it is? She said she knew the book was about that, but she didn't make the connection. And it was funny. I said, no, it gets under our skin. This is more than skin deep. It hurts us. And she said, oh. And I really like this book jacket because I wanted something with skin. And there's little scars in the skin of the person, in painting on the cover. And I thought that was so important to show that we are scarred just by living in America.
And also this whole myth that we don't feel pain.
Yeah.
Right?
Oof.
That our skin is somehow thicker.
Yeah. I got a letter from a gentleman the other day who heard me on the place we're not saying on NPR. And he was really angry because often I cite this study in 2016 in the University of Virginia that found in 222 white medical students believed one myth, about 40% believed one myth, and these are medical students, residents, and interns.
Say the year again.
2016, and there's been other confirming studies after that, but 2016 was the one, believed one myth about Black people, either that our skin was thicker than white skin, in other words, we don't feel pain, that we actually didn't feel pain the same way, it wasn't as intense for us, and there were some other myths. So this man wrote and he said, my son is really upset because he was one of the participants in that study, and he felt used, and he felt he was lied to, and he felt like it hurt his feelings. But now he's a doctor. And so then I'm looking at this letter and I'm thinking, yay, I'm glad his feelings were hurt.
That's the point.
Yes, that's the point. Now he's a physician now. He better not go in with those myths in his head. He learned his lesson.
But that is the struggle there, right? Is that the hurt feelings, especially with white men, it's almost debilitating.
Yeah, I don't care. And so
Right. Yes, I agree. I don't care either. I guess, ultimately I'm trying to sort of paint a broader picture of how this book can be a tool for us, and while also simultaneously facing the real issues that are still there,
And I think when I'm, talking about it, when I'm touring around, if I go to a city, I will get, if there's a medical school nearby, a public health school, a midwifery school, people will come out to hear me talk, and it's mostly white folks. And that really makes me happy to say, oh, here are people listening, they're trying, they're opening their minds. And I think that's good because they are the people who are going to care for many of our people.
I feel like that is, I feel like we're always saying now more than ever,
Yeah.
But I remember, my memoir is about, is called Surviving the White Gaze, and it's about having been adopted into a white family and raised in an all-white town and so on and so forth. And I spoke at a conference for white adoptive parents of Black children, and some of the questions that I got, what about rap music and some of the things that they're saying in rap music? And my son likes to wear his pants kind of baggy. Isn't that a problem? And things like this, and I am like feeling this rage, but also
don't let that
feeling
take
like,
out years off your life.
But feeling like they're asking, right? They're asking. So it's that's one of the reasons that I asked you about the sort of having to tell the story over and over again. Self-care, I hope, still plays a role in your life and from your Essence days.
People that know me know that I am on the soccer field. I see one of my soccer mates in the audience who's older than me. We're the two oldest. And, I do. I love being outdoors. I try not to internalize this stuff. I don't want to lose years off my life by being angry and by, being enraged all the time. And, I do have joy, and, I have family, and I have love.
And I would think that this book may have been slightly cathartic for you?
It was fun, but when it was over.
I mean, but to have it on the page, right? It's now
Yeah.
it's out of your mind. It's out of your body now.
People are very funny. They're like, oh my God, you write so many things. Do you love writing? I was like, I love to have written.
Yes. Same. Hard same.
Yes.
And with that, we are going to open it up to questions. There are 2 mics right here. Questions, anyone? We can also just call on you. Yeah, I can keep. If any,
Oh, that's my dean.
oh, she's got a question here.
Yep.
We go. Great.
I'm Carmen Green, and I'm the Dean of the City University of New York School of Medicine. As a part of, we thank you, Linda, for your many, many contributions, your continued commitment to addressing this issue. I'd also apologize to those people who feel that they've been hurt by the healthcare system. And I'll tell you that our school, the City University of New York School of Medicine, is proud to have people like Linda on our faculty. We're proud to have students who disproportionately look like the people in this room. We are number 5 in producing African American physicians in this country. So what I would ask as a person who is, as you know, spent their career working on healthcare disparities, and particularly pain care disparities, Linda, what advice, besides what you're doing now, would you have for healthcare professionals? My worry, one of my deepest worries, is that as people go through the helping professions, that we become more and more socialized by the majority, soon to be minority culture. What would you recommend that, if you could take your magic wand, which I know you have, what would you recommend besides the class that you're teaching for us this fall?
Well, thank you, Dr. Green. And one of the reasons I wanted to teach the class was because I heard about this group of students in California. So they were at the University of California, San Francisco, and they were studying medicine. They were getting a joint MPH from Berkeley. So they took a class with a really wonderful professor who was talking about the kinds of things I talk about: racial health disparities, medical inequality. And they got so on fire that then they went back and they started the Institute for Healing and Justice in Medicine. And they launched it during the pandemic in 2020. And they hadn't been thinking about these things. They were just gonna go be doctors. They hadn't been thinking about them yet. And then I talked to them. I'm really excited by them. And I said, well, how did you end up launching as 4 young women? They launched the organization. I said, did the school give you any money? They said, yeah, they gave us $700. I said, what, $700? And we said at the same time, for pizza. They had a mailing address. And I said, do you have an office? That was like their dorm. And they did that on their own. Right after they launched, they had 7,000 views. And they wrote a kind of a manifesto that was about the abolition of, using sort of racial stereotypes in biology in medicine. And I just thought, if those kids, they're in medical school in a joint program, could get it together, launch this thing to help other medical students, I think that's really exciting, is to take that activism that they had and share it with their classmates. So I think, I don't like to put all the onus on them. It's at medical schools like ours, we want to support, the young folks, the people who are, trying to make a difference. But, I would say just if you're going into medicine, if you're there, try to figure out if you have biases, if you, everyone does, face that. And I think that is a growing sort of movement among practitioners. Other questions?
I'm going to stand up. Thank you so much for that wonderful book, as well as what you've just discussed. I'm in healthcare. I've been in healthcare for over 25 years. I'm a physician and have worked with many colleagues who've really struggled with this idea that our profession has been hurting people rather than healing. I don't see a collective response or even a blueprint that has worked in order to limit implicit bias. The explicit ones are very clear, and we can put safeguards and interventions that could lead to better care of our patients, but the implicit bias ones and the systemic ones are very difficult. So that's one area I hope that you can speak about. The second is, I think the more kids and medical students engage in healthcare from communities of color, I think by sheer presence and by sheer volume, we will reduce that impact on health on the population, people of color. So if you could speak to what we can do collectively.
I'll answer the second part first, and I think that we have to encourage, support, and uplift our students, people who want to be the healthcare providers of the future. And it was interesting because on a separate note, I interviewed a Black woman physician she was talking about her experience as a mother for my book. But I asked her about what it took for her to get through medical school. And she's in her 30s. At every turn, there was discouragement. She went to majority white schools. And she graduated from Stanford. When she went to medical school in California, she was discouraged. She said all of us were. Well, I don't know if you're going to be smart enough to make it in this. I hope you can. She came from Stanford. So, I think that what we have to do is support our folks. And Dr. Green allowed me to sit in on, it was sort of like a black male initiative. Each one partner with each of the mostly black and brown medical students at CUNY, partnered with someone who had graduated from the program. It was the most beautiful combination of people. The younger folk were talking about, it was undergraduate, pre-med, and medical students. We're talking with the ones who had graduated, and it was really a beautiful combination and connection that they had together. And that really excited me and made me happy. In response to the first part, I'd like to point out the case of California. So California has the same maternal mortality problem as the country. So we're the only wealthy country where the number of women who die or almost die and resulted from pregnancy and childbirth is rising. We are the country where Black women are 3 to 4 times more likely to die or almost die. And we're the country where
3 to 4 times.
3 to 4
Every
times.
time I read that statistic,
It's
I have
terrible.
to say it out.
And a Black woman with a master's degree or more is more likely to die or almost die than a white woman with an 8th grade education. So that's how I got started writing about this, when I heard those statistics at my soccer game. Okay, anyway, so when California knew that in 2006, so they were one of the first states to have a perinatal quality care consortium, or I think that's what it's called. And so they looked at those statistics in California and they decided, we are gonna fix this. What we're gonna do is improve the protocols and the tools that doctors need and nurses need when there's a hemorrhage during childbirth, or when there's an emergency C-section, or some of the other emergencies that happen. So between 2006 and 2013, they improved those protocols. They had a toolkit and a list of what you do. So all hands on deck in a case of those kinds of emergencies. And you know what? It worked. the number of women in California who passed away, or birthing people who passed away, dropped by 55%, but the racial disparity did not change. So the legislators made the decision to say that is not enough. We can't doctor our way out of this problem. It's not just a high-tech situation. We have to try to attack the racial bias that seems to be happening in our system. And so they required, now in California, anyone who works with a birthing person, pregnancy, childbirth, and after, has to get some kind of anti-racism training. Then they expanded it to all healthcare providers. It's part of their continuing education by law. It's a great experiment. We don't know what's going to happen. We don't know if it's going to work. And certainly that kind of anti-racism implicit bias training comes in different qualities. Not all of it's great. But I think it's a nod toward, wait, we hear you. We're not just trying to, if you raise the water, all the boats rise. That doesn't always work. So, but thank you so much for your work and for asking that question.
We have time for one more question up here.
Hello, I'm an Asian psychologist in training. I'm curious, as you interview a lot of people, you see disparities in health, physical health. I'm curious, what are some pains that you see psychologically that's parallel to the physical pain, and what are some wisdom and needs for healing for the heart as well as for the body?
Thank you for asking that. And I think one thing is, when I talk about physical pain and I talk about what happened during enslavement, where there was this false notion that Black enslaved people had this super high pain tolerance. It's not just tolerance to physical pain, it was tolerance to emotional pain. Mm-hmm. So that's why it was okay to take people's children away, to separate families, to kill people in front of you. And so that through line still exists. In today's world, as far as sort of mental health, there is an idea that we're dangerous. And so when, during a mental health crisis, like what happened, Buffalo was the one that comes to mind. I think the guy's name was Daniel Prude. And, he was someone who was suffering from a mental illness, but he got killed by the police because of killed or harmed by I can't remember now, by the police. And my story in the book is about a friend. It's the brother of my friend who was suffering from bipolar disorder that he really tried so hard to treat. Then he was using illicit drugs to also, when the downs came, he liked the highs, the downs came, he used drugs to manage that. He was involved, the cops came after him when he was using, in a high-speed car chase. They murdered this man. He needed treatment, he needed care. He did not need policing, he needed help. And so that happens because of the idea that instead of kindness and treatment and care, we need to be controlled and to be hurt and policed. And so that is, the one thing. The other thing that affects us in the healthcare system, less dramatic, but that there's just not enough what they call culturally competent or, enough providers, mental health care providers that look like us or that understand our experience in America. And it's kind of even more important when you're talking to someone or you're needing treatment for someone, that they understand your experience and not that they see you as a problem or a danger. So those are the kinds of things that come up with mental health treatment. And the other thing that I covered in my book is what depression may look like. Depression doesn't always look like sadness. Sometimes it looks like anger. Mm-hmm. So if you are depressed and you need treatment and you need care, but you're manifesting it in anger, again, you run the risk, if you're Black in America, of being policed instead of cared for.
And this will be our last question.
Hey, Linda.
I'm Miriam. That's my student, my journalism student.
So, I don't know if it's a good question to end, but for the people who have not been able to incorporate these conversations about race and inequalities of race and want to start incorporating the conversations, but are afraid to cause some weathering to the people in trying to start the conversations, what would be the advice?
That is so important, and I've seen, I've seen people grappling with this issue. I think one of the things is to, it was interesting, when I was at Essence, I was on a panel with, with white magazine editors, and they were all kind of like, oh my God, we can't find any black folks to work in our magazines, our women's magazines, our white women magazines. And I'm like, do you have no friends of color?
Yeah.
Oh my
Again,
God.
yeah.
None? Do you have no one you can talk to?
Nope.
And so I'd say, some of these conversations they can be cultural conversations. And as black folks, we want to talk about these things, but we also want to listen to the experience of other people that aren't African American always. And I think kind of conversations with people you care about and people you love. But I think all of us need to look around and make sure that we are socializing with and being around people who don't look exactly like us. And I don't always mean just a black-white thing. And I think that's important, and I think that's a way we can do a kind of healing in the most segregated country, in such a segregated country and in such a segregated city, but in a city where it is a melting pot. We need to figure out how to reach our hands. Now I sound like we are the world, but I think that is a step in the right direction, and I kind of love that. That's why I'm looking at my friend Sydney down here. Our little soccer group is, we have 2,000 people. We play with people from all over the world. It's one of the most enriching activities that I've ever been involved in, and it's really opened my mind. And teaching is the other place, in college. In our, we're at CUNY, and it's just one of the most interesting places to, spend my day, where I can just talk to people and listen to people that are not always like me. Thanks, Miriam.
Thanks, everybody.
Thank you.